Good evening to everyone and welcome to our live session. Thank you so much for joining me tonight. I truly appreciate you taking the time to be here. My name is Ambika Joseph and I am the Managing Director of Care Transition Clinic. I am a registered nurse, a nurse educator, and a public health practitioner. Tonight I'll be discussing a very important topic, diabetes mellitus. And this session is specifically for individuals who are living with this condition, as well as family members, caregivers, and anyone who wants to understand this better. So the reason why I'm doing this, this session is because as a nurse, I realize or observe that there is a lot of individuals in the community that I care for who suffers from diabetes mellitus and is not fully aware of their condition. So especially when it comes to understanding it and how to properly manage it and care for themselves. So education is a very powerful tool that I use in preventing complication. So I'm using my platform, Care Transition Clinic, to educate as many persons as possible. So throughout 2026, I will be hosting a number of series on chronic disease management. We will conduct a various of conditions that affects our community. And I will provide practical guidance, prevention, control, management, and ways you can improve your quality of life. So this is just the beginning of many more important discussions to come. So tonight, let us begin by understanding what is diabetes mellitus. So diabetes mellitus is a chronic metabolic disease where the body cannot produce or properly control blood glucose level, right? And when I say chronic, we mean that it is long-term, right? It does not go away after a few days or even weeks. So it requires lifelong management. And when we say metabolic, we are talking about how long the body takes to process foods and turn it into energy. So the main issue with diabetes in the body is that it cannot properly regulate or control the level of glucose in the blood. And what is actually glucose? So glucose is simply sugar in the bloodstream that comes from the food we eat. So the foods such as carbohydrates, rice, bread, pasta, sweets, and these are not bad sugar. The body actually needs glucose to maintain a source of energy to actually function, right? So it keeps the brain working, it keeps the muscle moving, it keeps our organ functioning. And without glucose, we cannot survive, okay? And this will take us to how the body normally controls blood sugar, right? So now that we understand what is diabetes, let's look at this image. So the body is constantly trying to maintain balance, right? And this balance is called homeostasis, right? So blood sugar should not be too high or too low in the body. And when that happens, the body will try to keep it within normal range. Now, there's two main hormones responsible for that balance. And that two hormones is insulin and glucagon. So both are produced by the pancreas in the liver. And as you can see on the screen, the yellow diagram is the pancreas, which produce both insulin and glucagon. Now, when blood sugar level is high, carbohydrates are broken down into glucose, and the glucose enter the bloodstream, right? So the pancreas now will detect that rise in the body, and it releases a hormone called insulin. And you might be wondering, what is insulin? So insulin acts like a key, right? It unlocks the body cells, especially the muscle cells and fat cells, allowing glucose to enter the cells. And once glucose is inside the cells, it is used for energy. So extra glucose is stored in the liver as glycogen, right? And this process lower blood sugar level. So as you can see on the diagram, there is the high blood glucose in the blood, and the pancreas detects it. It releases the hormone called insulin. The liver stores glucose as glycogen, and the blood sugar decreases. When blood sugar is low, so if a person has not eaten for several hours, the blood sugar will drop, right? But the body still needs energy to function. The pancreas again will detect that low blood sugar level, and in response it will release the next hormone called glucagon, right? And what is glucagon? So glucagon does the opposite to insulin, right? It signals the liver to break down the glycogen into glucose, right? And then glucose is then released into the bloodstream. So from the diagram, you will see that low blood sugar, the pancreas releases glucagon, the liver breaks down glycogen into glucose, and the blood sugar increases. So that you can say that insulin and glucagon work like a balancing system, right? Insulin lower blood sugar level, and glucagon rises the blood sugar level, right? So they work opposite to each other to maintain that balance. And what happens in diabetes, right? So in diabetes is either the insulin is not produced, or the insulin is not working properly, or both, or the body cannot respond to insulin as it should. So as a result, the glucose stays into the bloodstream instead of entering the cell, and this is why most persons have high blood sugar level. So most persons think that diabetes is just one condition, right? But there are different types of diabetes, and they develop for different reasons. So here we have type 1 diabetes. It is an autoimmune condition. The body immune system mistakenly attack the insulin-producing cells in the pancreas, right? And as a result, the pancreas produces little or no insulin. So without insulin, glucose cannot enter the cells, so that the glucose remains in the bloodstream. So type 1 diabetes usually develops in children or young adults, and it is not caused by eating too much sugar, and it requires long life insulin injection. So key point I want you to remember that people with type 1 diabetes, they cannot survive without insulin. And we move to the next type, which is type 2 diabetes, right, the body still produces insulin, but it does not use the insulin properly, right? And this is called insulin resistant, right? So over time, the pancreas become very weak, produce less insulin in type 2 diabetes, right? And type 2 diabetes is most times linked to obesity, poor diet, physical inactivity, family history, right? Type 2 diabetes can sometimes be controlled by diet, exercise, medication, and sometimes insulin. It is important to note that type 2 diabetes, it develops gradually and may go unnoticed over time. And we will look at the next type, gestational diabetes. This type occurs during pregnancy, and it usually disappears after pregnancy. So with pregnancy, you have hormonal changes taking place, and the body, which can make the body very resistant to insulin. And as a result, you have the blood sugar level rising, which will lead to the gestational diabetes. Now, this can affect both the mother and also the baby if this type is not controlled. So it's important for pregnant mothers to get screening to find out if there is any possibility of gestational diabetes. And then we have prediabetes. This is when your blood sugar level is higher than normal, right? But not high enough to be diagnosed with diabetes. And this is actually a warning sign. And the good news is that with proper diet, exercise, weight control, diabetes can be prevented at this stage. So to recap, all type of diabetes involve some problem with insulin. We know that type 1, there is no insulin. Type 2, the insulin is not working properly. And gestational diabetes or temporary insulin resistance during pregnancy. And prediabetes or early warning stage. And we move to the risk factors of diabetes. So a risk factor is something that increases your chances of developing a disease. And it does not mean that you will definitely get the disease, but it increases the likelihood of getting the disease, right? So most of these risk factors are linked to type 2 diabetes. And we have family history. If your mother, your father, your brother or sister has diabetes, your risk is higher, right? And there is a genetic component as well. However, genetics alone does not cause diabetes. Lifestyle also play a major role. Being overweight or obese, right? Excessive body fat, again, especially around the abdomen, increases insulin resistance. So when the body becomes resistant to insulin, the pancreas has a very harder time to work, and over time it becomes very exhausted, right? And in that case, the blood sugar level begins to rise and results in diabetes. Physical inactivity. So when you do not exercise, the muscles do not use glucose effectively, right? So insulin becomes less effective, blood sugar remains elevated, right? So we know that regular exercise activities improve insulin sensitivity, right? And even if you walk like 30 minutes on a daily basis, you can reduce this risk significantly. Unhealthy diets. Diets high in sugary drinks, processed foods, refined carbohydrates, fried foods, all of those increase the risk for weight gain and insulin resistance. So excessive sugar alone does not directly cause diabetes, but it will contribute to the weight gain and metabolic stress. High blood pressure, hypertension and diabetes are often linked together. So high blood pressure, it damages the blood vessels when combined with high blood sugar level, right? And all of that is a risk of complication. Then we have high cholesterol. Abnormal cholesterol level, increased cardiovascular risk. Diabetes and heart disease are closely linked. Age, the risk increase after 45. As we age, the body becomes less sensitive to insulin. Physical activities often decreases. However, what we're seeing today is that younger people are increasingly developing type 2 diabetes due to different lifestyle habits. And again, gestational diabetes, women who had diabetes during pregnancy are most likely to develop type 2 diabetes later on in life. Now, many of these risk factors are modifiable, and this means that you can reduce the risk by maintaining a very healthy weight, exercising regularly, eating a balanced meal, monitoring your blood pressure and cholesterol level, and preventing all possibilities that can cause complications. So we will now look at the signs and symptoms of diabetes. So these symptoms will occur once there is too much glucose in the bloodstream and not enough glucose inside the cell, right? So remember, as I said before, glucose is supposed to enter the cell to give the body energy to function. And when it stays in the blood, that's when the problem begins, right? So we have symptoms like frequent urination, excessive thirst, increased hunger, unexplained weight loss, fatigue, blurred vision, slow wound healing, frequent infection, tingling and numbness in the hands and feet. So I know you're probably wondering why there is frequent urination, right? So what really happens, the kidney try to remove excess glucose from the blood, which causes glucose to pull water with it. And as a result, the person urinate more often. So you may find yourself waking up several times at nights to urinate or passing a large amount of urine. Excessive thirst. So because the body is losing fluid through frequent urination, the person becomes very dehydrated, okay? And the brain signal a thirst so that the person can drink more water, but still they feel thirsty, right? Another thing that you will find being excessive, feeling hungry excessively. So even though there is a lot of sugar in the blood, the cells are not receiving it, right? So the body thinks that it is starving, and which causes the increase or the increased hunger, okay? Unexplained weight loss. So when glucose enters the cells, with type 1 diabetes, since the cells cannot get enough energy, the body begins to break down fat, right, and muscles for energy. So this leads to weight loss, even if the person is eating normally, right? And fatigue, glucose cannot enter the cells, the body lack energy, and the person feel tired, weak, and drained. For blurry vision, high blood pressure causes fluid shifts in the eyes. So this affects the lens to lead to temporary blurry vision, and over time, uncontrolled diabetes can cause damage to the retina. Slow wound healing. So damaged blood vessels, reduce circulation, all those areas weaken the immune response. So if you have a cut, if you have wounds, they take longer to heal. And frequent infection, where there is high blood sugar level, it creates an environment for bacteria and fungi to grow easily. So persons may come down with recurrent urinary tract infections, yeast infections, skin infections. And then we have tingling and numbness, right? High blood sugar level, it damages the nerves over time, which may cause tingling, burning sensation, numbness, and pain in the hands and feet, right? So important to note that type 2 diabetes can develop slowly over time, and some people have no symptoms at all. And this is why we encourage regular checks and screening to ensure that you are free from the disease. Now let's look at the complication of diabetes. Why is high blood sugar is dangerous? Okay. So diabetes becomes dangerous when the blood sugar remains high in the blood for a long period of time, right? So high blood sugar level, it acts like a poisoning in the bloodstream. And over time, it damages vessels, it damages the nerves throughout the body. And when the blood vessels are damaged, the organs cannot receive proper oxygen and nutrients, which lead to the different complications. Right, so the complication can be both short-term and long-term. And I will look at the short-term complication now. So you have very low blood sugar. It can be from skipping a meal, or probably taking too much insulin, or probably from excessive exercise, right? So you will have symptoms like sweating, shaking, dizziness, confusion, and even fainting. Now, if your blood sugar is extremely low, this can lead to a coma, right, which is a life-threatening condition. And then we have very high blood sugar, right? You will experience symptoms like excessive thirst, as I said before, frequent urination, fatigue, and if untreated, that too can be life-threatening. Now, if your blood sugar level goes really high, and when I say really high, it reads from 300 milligrams deciliter. This is actually leading to a condition called diabetic ketoacidosis. It is a medical emergency. In that case, there is no insulin. The body turns fats for energy, and this produces acid called ketones, and ketones build up in the blood, which will lead to that medical emergency, right? So some of the long-term complications are heart disease, right? So diabetes increase the risk for stroke, heart attack, and it damages the blood vessels and promotes plaque buildup over time. So cardiovascular disease is the leading cause of deaths in diabetics, right? And then we have eye damage. which is known as diabetic retinopathy, right? You have a complication where the high blood sugar, it damaged the small vessels in the retina. So you have blurry vision, vision loss, and it may even lead to blindness. Nerve damage, we call it neuropathy, that's the medical term. It damages the nerves over time. So this is where the tingling, the burning sensation, the numbness comes from, especially in the hands and also the feet. Now, loss of sensation in diabetics, it increases the risk for injury. Okay. So another complication you might have is kidney damage, and over time, the blood sugar damage the tiny filtering units in the kidney, which lead to protein in your urine, kidney failure, and also eventually which will lead to dialysis, right? So diabetes does not kill suddenly, it damages silently, right? And the complication are what make diabetes dangerous, right? But the good news is that most complication can be prevented with proper blood sugar control. So now you're probably wondering, how is diabetes diagnosed, right? A medical doctor is the one to diagnose someone with diabetes, right? And this diagnosis takes place through blood tests, right? And there is a number of blood tests where they have fasting blood sugar level, the HbA1c test, oral glucose tolerance test, and random blood sugar test, right? For fasting blood sugar, the test is done after not eating for at least 8 hours, right? And normal, you have the normal range less than 100 milligrams per deciliter. In pre-diabetes, you have 100 to 120 milligrams per deciliter. And in diabetes, the reading will be 126 milligrams or per deciliter or higher, right? So this measures how well the body controls sugar when you are not eating. Another test is the random blood sugar test. This can happen at any time during the day, right? If the level is 200 milligrams per deciliter or higher, along with symptoms of diabetes, then you may be diagnosed as a diabetic. And then we have the HbA1c test. So this is the most reliable test to diagnose someone with diabetes. The HbA1c, it measures your average of blood sugar over the past 2 to 3 months in the body, right? And a normal value will show 5.7%. In pre-diabetes, we spoke about that before, 5.7 to 6.4%. And with diabetes, have to be 6.5% or higher. And the glucose tolerance test, most of it is done for pregnant women. What will happen, you will drink a sugary solution and the blood sugar will be checked after 2 hours, right? And as I said before, this test is done for most pregnant women. Now, how would you manage your condition, right? So diabetes can be managed successfully by a few changes. Healthy diet, balanced meals by incorporating more vegetables, whole grain, lean, protein, less processed food, right? The most important thing is that portion control is the key. And then you can do regular exercises, at least 30 minutes daily. What exercises does, it lower the blood sugar level, it improve insulin sensitivity, it also help with weight control. Even brisk walking can also make a difference. So for persons on medication, some probably may require oral tablets, insulin, injection. Medication also help lower your blood sugar level. It is important to be compliant with your medication and not to skip any doses, right? So blood sugar monitoring, you want to monitor your blood sugar on a daily basis. That helps you to track, control, prevent complication, and also you'll be able to adjust your medication. So what we always tell our patients to get regular checked up by the doctor. You go to do your eyes exam, foot exam, kidney functioning tests, and also monitoring of your blood pressure, right? So preventing those complications is essential. So diabetes is serious, but it is manageable, and many people live long, healthy lives with proper control. And the key is for education, right, consistency, and regular monitoring. So this is the end of this presentation. I hope that the information is very informative, and you would have enough information as to how to care for yourself, know what is diabetes, know the different tests and so forth that will be, and how to manage your condition. Thanks for viewing, and I will see you next time.